This is Sophie here. So now that we've addressed the theory from our presentation relating to rapid sequence intubation, we'll now move on to some of the practical skills, which addresses directly our intended learning outcome 8 to demonstrate how to secure an artificial airway, specifically an endotracheal tube. So by the end of this skill station, we should be able to safely and correctly secure an artificial airway. As has been covered during our PowerPoint presentation, appropriately securing an artificial airway is critically important for patient safety. Patients that require rapid sequence intubation specifically are generally very ill, deteriorating quickly, and may not be able to maintain their own airway. Therefore, if it is dislodged, this is a life-threatening medical emergency. So, we need to approach this session today with a specific technique that has been widely used called the see one, do one, teach one. So you'll see me and a fictitious assistant who will be my endotracheal tube holder. Unfortunately, due to limited resources and personnel in the hospital, it is just me, but we'll imagine for today that there is a person there holding my tube while I work. So basically what we'll be doing, we'll be going through some equipment that we need for today. So some things that are really important will be our PPE. So we have gloves and gowns here presently sitting in the shelf behind me. So you'll be able to see that here. Gowns and gloves on the shelf. You may need protective eyewear. There is a risk of coming into contact with sputum and blood. We want to make sure that we're protecting ourselves as well. So make sure that the bed is at a comfortable height for you. We don't want any manual handling issues. Now, something that's really, really critically important when we go through this skill is to ensure that our ETT is at the correct position. So this is going to be a marking on the side of our tube in centimetres. We can measure it either from the teeth or from the lip, but as long as one of those two measurements has been established, we know what it is, we can be sure that our endotracheal tube is in the right position, which is very important for patient safety to ensure that we're ventilating them correctly. So we have a couple of different securement devices. We have either an E-tab, which unfortunately we don't have here present today. We have endotracheal tapes and we have endotracheal ties. So the tape is elastoplast tape and the ties are a white ribbon material. So we have an abundance here today to allow for as many practices as the time permits, which is fantastic. We also have to have our scissors present so that we are able to cut our equipment into the sizes that we need. So we're going to go through the technique shortly, but I'm just going to give a little bit more of an overview of what we're planning on doing for today. So we'll be practicing the activity in teams of 3 or 4, and we'll be taking turns to tube hold and to tie off. There is extra equipment available for any practices. And the other thing that you'll have access to, which I think is really important, is the checklist here, which is what I'll be using to assess your performance against today. So, while we're doing that, I'll engage in some informal feedback while we're doing our practice round before we then move on to the teach one, do one component. At the end of that session, we'll have a bit of a private conversation just in this simulation room, just to determine how you feel about your performance and anything that we can look to for the future for improvement. This is known as a feed-forward technique. Now, just some ground rules. This isn't designed to make anyone feel bad or incompetent. This is purely designed for educational purposes. So that means respectful behaviour is absolutely necessary. Whatever happens in simulation stays in simulation. No rude remarks, no calling out. It's pretty simple, and I think that's pretty reasonable. I think everyone would hopefully agree with that, but feel free to let me know if there's any issue. So this is going to be the technique that I'm going to show you. Many techniques, but here's how we do it here. So we've got our lateral airway trainer, we've got our ETT in situ, so we're going to pretend we've got a ventilator here, the patient's just been intubated, we've just had a chest x-ray, we've confirmed the position, the doctors are happy that the patient is going to ventilate safely. So we need to tie off our tube, okay? So we have our tape here, we have our ties, we have our PPE available if we need it. For the purposes of this video, I'm not going to use it, but we have it if we need it. So the first thing that we're going to do is check and see our markings. We usually use the teeth, and it looks like for this patient that the tube is in approximately 16 centimetres. So we're making a mental note that at the teeth, we are 16 centimetres. So we're going to start to get our equipment ready. So we're going to have our ties ready with a loop, and we will have our tape ready as well. And so between average 10 to 12 centimetres, we're going to cut our elastoplast tape, all the while our assistant is holding our airway secure. And you can do this as many times as you like, just to ensure that you feel comfortable with the equipment and the sequence of the steps. So we're going to create our little pant legs. So one piece is to anchor the lip and one piece is to anchor the ETT. And so what we're going to do is, with our friend holding our ETT in place, we're going to choose one cheek that we're going to adhere the tape to. It's very difficult when it's a dummy. It is less difficult with a real person, but for the purposes of this video, we will persevere. And we will loop that tape around the ETT. And so you'll see here that we have a piece of tape that is affixed to the cheek, and we have a piece of tape that is looping the endotracheal tube. Fantastic. Once that is nice and taut, we'll be taking our ties as our second point of anchor. We're going to loop this around the tube, and we're going to pull our ends through. Once our ends are pulled through, we are going to tighten the ties as close to the lip as is possible to hold the ETT in the same place. And you can see here that there is a loop and that it is held taut to the top of the ETT. After that, we're going to secure that by wrapping the ties around the patient's head and choosing one side of the cheek, ideally avoiding any bony prominences or the ears, but making sure that we are sufficiently taut. Some people find that having an extra person, the person holding the tube, to provide a finger as an anchor, like you're wrapping a Christmas present, just helps to tie it off, which we've now done. And as you can see, we have a nice, secure airway. Fantastic. Alrighty, please stay tuned and we will proceed with our practice round if there aren't any other questions. Thank you. Bye.